Dr. Grande is a licensed counselor and a popular YouTuber with a large following of 1.3 million subscribers. He regularly posts videos on topics related to psychology to frequently analyze and discuss cases of celebrities and murderers. He uses a variety of techniques to analyze and explain the behavior and motivation of individuals, especially the 5-factor model of personality and the DSM, that is to say the Diagnostic and Statistical Manual of Mental Disorders. However, there are critics who question his ethics and qualifications. It is above all his way of speculate about different diagnoses and mental disorders that can be harmful.
Despite his channel name and content, he is not a licensed psychologist or psychiatrist. He is using the power of suggestion to make viewers believe that he has expertise in the field, even though he is not a licensed psychologist or psychiatrist. This is a form of psychological manipulation, as Dr. Grande is exploiting the power of authority and people's desire for knowledge and expertise in order to build credibility and trust with his audience. This can raise ethical concerns as it can be misleading to viewers who assume that he has the necessary qualifications and licensure. It can also be dangerous for those seeking help, as it can lead to inaccurate or harmful advice.
It is also considered unprofessional by many psychologists and therapists since he exploits people with mental illnesses for money and fame. Furthermore, you cannot speculate about mental disorders if you have not met the person. To do this, direct observation and interaction with the person is required using reliable methods such as structured interviews and personality tests.
A specific example of the limitations of his speculation is the case of Lawrence Ray. In this case, Dr. Grande claims that Ray appeared to have psychopathic characteristics like being manipulative, having superficial charm and having no remorse. Let's break this down. According to psychological evaluation, Ray never received a diagnosis of psychopathy. However, he has been diagnosed with narcissistic and histrionic personality disorder. Furthermore, according to a report from 2014, he rather has characteristics that are strongly suggestive of pseudologia fantastica, or Munchausen's disorder. This means that the underlying reasons for his characteristics of being manipulative and having superficial charm is to get attention and impress others. A psychopath, on the other hand, would use these character traits in a more sinister way to exploit others for their own benefit, like money and status. Second, besides the fact that he has never been diagnosed with psychopathy, only 1% of all men have this disorder, which makes it more likely that he should be to have remorse. In summary, speculating about diagnoses and disorders without the right qualifications, procedures and evidence can lead to harmful consequences. Some of the harmful consequences that it can lead to are the following. 1. Prevent or delay appropriate treatment for their condition. 2. Misdiagnosis or overdiagnosis that can result in inappropriate interventions and cause adverse effects on the person's mental health. 3. Damages the integrity and reputation for the person being speculated about, which can damage their self-esteem, relationships and future opportunities. It is for this reason that the American Psychiatric Association, APA, adopted the Goldwater rule in 1973, which prohibits psychiatrists from proffering diagnoses of current public and political figures. The informal name of the rule comes from the 1964 presidential election, where Fact magazine published an article about presidential candidate Barry Goldwater's psychological fitness. In the article, psychiatrists across the country had participated in a poll regarding Goldwater's sanity. The result of the poll was that 1,189 psychiatrists agreed that Goldwater was emotionally unstable and unfit to be president. This article was widely circulated and led to compensatory damages, and $75,000 in punitive damages. But the more important thing was that it resulted in a change to the ethics guidelines of the American Psychiatric Association. The lesson of Dr. Grande's speculations about diagnoses and disorders is to use critical thinking, not to jump to conclusions, and recognize the complexities and nuances involved in analyzing a case psychologically, especially when done without the proper qualifications, evidence and procedure.